Yeah, that's what I want to talk to everybody. It looks like, just FYI, everybody can hear us
Okay.
as we're getting started. So if you can't
Okay.
hear us, that's great. We're just trying to figure out the final details, guys. We're really sorry. And we're trying to get Julie on this thing to join us, and we're going to go live. Um, see if email. Julie, can you check if you received an email with the link and the password? Mary, that's what you use, right, to log
Yes.
in? Yeah.
Yep.
So, Julie, can you see if you could receive that? If you can hear me?
I had to unmute if maybe she needs to do that on her screen.
Oh, I'm gonna make a mix numbers and reach. Sorry.
Sometimes technology is not our friend.
Yeah. All right. If not, then we're gonna get started pretty
Yeah,
soon.
we can go ahead and get started.
Is there anything, Mary, that you would be showing during this webinar, or any presentation materials, or are we just gonna chat?
Let's just chat.
Okay. Awesome.
And then
Um,
I do have some presentation material that I will share with you, and then you can push it out to everyone.
okay. So everybody who joined, we received the email addresses, and then we'll be able to um, share all the files. Um,
Yep.
okay, so we're almost ready, guys. So really, really sorry. We didn't expect that many people will be on this webinar. So not that we're not planning, but it was such a short notice, and we thought probably not 50 people will join, but it looks like we got so many people. So it's incredible. We're grateful. We just need another minute. And Julie, trust me, we'll try to figure this out.
Did you see her chat? She said she's here.
Yep. Wait, why? Oh, yeah, yeah. Now I can see the chats. Awesome, Julie. Just give us a second. Okay. Just a minute.
Thought I put my phone on do not disturb.
All right, so we don't want to. I apologize. Something we need to figure out on our end. So it's not allowing us to go more than 25 people, but people can go to YouTube and watch this live on YouTube. So we're live streaming. I guess I'm just gonna jump in. Julie, sorry. I'll make sure to do another one with you definitely, because I would love to have your feedback and make sure that we're on the same page. So, Mary, let me start with, while I'm pulling up the questions, so let me start with something like, we've never seen anything like this before, right?
No, we never have, not on this scale. I mean, if you many of you remember back in, oh gosh, about 2002, I think, was when we had the H1N1 virus, somewhere around there, and there were a number of deaths, there were a lot of cases, but there was nothing on this scale. I think the difficulty we're having right now is on several levels. One, this is a new virus, evolved from the SARS coronavirus that happened in, actually, that was in 2002. The H1N1 was 2009. But we don't know everything we need to know about this virus. Like, we don't know if people, once they recover, if they'll have immunity. We really don't quite understand what we've discovered. And by we, I mean just the community in general, that people who have been exposed may not know it, but are asymptomatic. They're not coughing, they don't have a fever, but we now know that they're shedding virus from within a couple of days after they were exposed. So it's not like when somebody has the flu, they typically start showing symptoms within a day or two after they get sick. And so we know who to avoid to try to avoid getting the flu. With folks that have been exposed to this virus, we don't know because they don't know. So it's making it very, very difficult. And with the flu, usually people will develop their symptoms quickly and they get bad and then they gradually get better. What the pattern seems to be happening with a lot of the patients who get really sick with coronavirus, they start out kind of slowly and then their symptoms, their cough gets worse, and all of a sudden they develop pneumonia very, very quickly. They go downhill very fast. And the demographic in this arena is starting to change too. You've probably all heard that it was elderly people, 60 and over, people with underlying medical conditions were the most vulnerable, and that's where most of the deaths were. But now we're starting to see a younger demographic. The CDC said yesterday it was people, young people or younger people between 20 and 54 that are 50% of the hospitalizations now. So as of today, although our president says it's fake news, there's 14,000 cases identified. There's probably 10 times that. We just haven't had the testing to be able to quantify how many cases. And there's been, I think I remember they said something like 200 deaths from the virus. So we've got to get it under control. And that's why, you know, California and New York State have issued these directives basically to not go outside. Businesses are closing and all those things to try to stop it.
Yeah. So the good thing is, I guess, in all of this, unfortunately, but to combat this thing, offices are going to be closing, right?
Yes. On Monday, this past Monday, the American Dental Association issued a statement calling for dental practices to only see emergency patients, not to see patients for elective treatment for 2 weeks. No, they said 3 weeks. And then a lot of state dental associations said the same thing, anywhere from 2 to 3 weeks to be closed. Now, that's not a legal mandate because the ADA is not a regulatory agency, but the ADA has then set the standard of care, and the standard of care right now is that practices should be closed to all but emergency patients. So some practices have chosen to stay open, and if they do, it's risky because they're putting the team members at risk unless those team members have N95 masks available to wear, because we know that our level 3 masks do not protect us against the coronavirus. It can get through the masks, and it can remain active in the air, they believe, for about 2 hours after we stop producing the aerosol from the handpiece or the ultrasonic scaler. So if a team member gets sick, obviously or a doctor gets sick, that's obviously going to cause problems. If a patient gets sick, it could be even worse because the patients could file a malpractice suit against a doctor, and the malpractice insurance that all of our doctors have won't cover any liability in that case, because the practice would have been open, seeing patients for elective care against the recommendation and practicing below the standard of care. So yeah, and the thing is, people think, oh yeah, we're going to be closed for 2 weeks and then we're going to open up and it will be business as normal. We don't know that at this point.
Yeah.
The CDC could step in and say we need to stay longer. Washington State their governor has issued an order, which means it's a legal mandate, that dental practices stay closed until the 18th of May. So almost 2 months. Wow. Yeah. Oregon did the same thing, and their mandate is until, I believe, the 24th of April. So this is totally unprecedented. This is going to put an economic hardship on practices, but it's an economic hardship on everybody at this point.
Yeah, I think probably a couple of the things on this I wanted to circle back. It's definitely we're all in it together.
Yes.
As we're looking at all these different things. For Zen people, we are working really, really hard to get the N95 masks available. I was checking with Mary earlier today about one of the suppliers that are getting the KN95, which is from CDC website, was a link that it's similar to N95. But if the offices are seeing just emergency patients, what's the process? Like, is it the same what we did before, the disinfections, or is there anything that's going to be different?
Well, there won't be anything different. That's a great question. There wouldn't be anything different in terms of disinfecting surfaces or sterilizing instruments. What's different is the personal protective equipment. Okay. Because many practices before they shut down were still wearing their level 3 masks, but we're told that that is not appropriate. If you have to do an emergency procedure on a patient and you can't get N95 masks, then the next best thing, although it's not ideal, would be to wear a level 3 mask and wear a chin length face shield.
Okay, so level 3 and
wear a chin length face shield, but that's most likely not OSHA compliant, but I think that OSHA is going to probably be a little more flexible right now because we can't get the equipment. And I can't, Tiger, if you have the link for the CDC on those KN95s, I can't find anything.
Okay, let me see if I can share the screen.
Okay. I mean, it would be better. The one big difference between the KN95 is that they are not size specific, and so they wouldn't give you a very good seal around the face mask, but it is the same filtration rate as an N95. So that would be better than a level 3.
Can somebody just drop in the chat if you guys can see what we're sharing? I just hope that people can see
see it.
You can see it? Okay.
Yeah.
So this is where we're looking, use of respirator approved under, and those masks, thank you, Vanessa, those masks, that N95, and yeah, everybody who said yes, thank you so much, guys. So these masks, they're not level 3. They're considered to be respiratory devices, right? The
Right,
N95.
right.
Yeah. And so this is where I saw that. So if they're coming from China, the KN95
Hmm.
protection factor, the yes. So we will have the K. Actually, no, we just added today the KN95 is available through the supplier Boom Supply. So just for our people, if you guys curious.
Okay. Well, NIOSH has not said, the National Institute for Occupational Safety and Health has not said that those are acceptable. I think it's kind of a gray area, but those would certainly be better than level 3s at this point.
Okay.
And they're available.
Okay.
So the problem is the ones that are coming from China are probably not cleared through our Food and Drug Administration for use in healthcare.
Mm-hmm.
We've been told that the FDA is loosening some of those standards to try to make things available, but I have not seen anything that specifically references those face masks. But again, it would be better than a level 3.
Okay. Okay. All right. So I'm gonna end sharing for now. So should we put this link somewhere available for people? I'll just include it just in case. I'll just drop it somewhere in resources. I'll just put here in the notes.
Yeah.
Okay, so offices are going to be opened for seeing just emergency patients. There's no additional way of protecting or disinfecting offices except wearing the N95 masks.
Right, exactly. But there's some things that you could do. Like one of the recommendations from the CDC and some other groups is to take all of the magazines out of your reception area because you can't disinfect them. So if somebody came in and was potentially infectious and they're touching those items and then other patients could touch them, that you temporarily remove toys if you have them for the little ones in the reception area, and that you frequently, if you were seeing a lot of patients, that you would frequently disinfect doorknobs and countertops and areas in the reception area, and that you should ask your patients to wash their hands or use hand sanitizer when they come into the office. So they come in and check in at the front desk, and you, if you have hand sanitizer, that you give them some hand sanitizer to use, or you direct them to the restroom to wash their hands.
Awesome. We also had a couple of people just dropping the comments. Vanessa wrote they also removed their tablets, which is probably a good thing,
Oh,
right?
yes, absolutely. Thank you, Vanessa. Absolutely. No, I would not use any of those touch devices around the patients. No, no tablets.
Okay.
No.
I mean, the regular cavi wipes, the 1 minute or 3 minute, it's the same thing, right? There's no additional things on that.
No, and I've had a lot of questions this week from team members asking what's the best or what's effective against the coronavirus. Because this is a new emerging pathogen, you won't see it listed on your label for your product. But the FDA is saying that they have some special processes now for companies to go through to get an approval for what they call new and emerging pathogens. But a lot of products out there on the market will say that they're active on the label against human coronavirus. So if you see that on the label, human coronavirus, then most likely that it will kill COVID. We are assuming that it is. There is one disinfectant out there. It's called Advanta Clear from Hugh Freedy, that does make a label claim that I know of for sure for human coronavirus. I haven't seen that on the Cava wipes. I haven't seen it on some of the other products, but that doesn't mean it doesn't kill. So there is, and I'll send you a link. I need to write myself a note. It's called the List N from the EPA, the Environmental Protection Agency, where you can go to this link, and I will send that to you. You can go to the link and you can look at this chart of products that are effective against the coronavirus. So you know, but the reality is that this virus is fragile, and the disinfectants that we use to disinfect our treatment rooms are supposed to be tuberculocidal. TB bacteria are spore-forming bacteria, so that there's among the most difficult or the most difficult to kill. So if we have a product that is tuberculocidal, it's going to kill everything else. There's another term you might see on labels for your disinfectants. It's called enveloped virus, because that's what these viruses are. So it either will say human coronavirus or enveloped virus.
Mm-hmm.
Don't worry if it's not on the label, because these manufacturers have most likely printed these labels and packaged these products before a lot of all this pandemic, began to happen, and so they just haven't caught up with labeling yet.
Okay. There was another good question from Vanessa. Vanessa's on fire. Vanessa, you're awesome. Do you recommend removing?
Vanessa.
Exactly. Do you recommend removing our coffee machine also and a fridge access?
Yes, I would. And there are many practices that have built in these beautiful coffee bars in their reception rooms, and some of them have just put big signs up around them and said, please don't use. But yes, anything that could potentially be handled, or somebody could be touching with hands that maybe have been in their mouth or something, no, get rid of that for now. No coffee bars, no refrigerators, none of that.
Wow.
Yeah,
Okay.
I know. We're going to end up with a very new normal, I think, when we open our practices back up, because the reality is, even if we stop the spread or the numbers of new cases, you keep hearing the term flatten the curve. So we're still going to get new cases of virus, but they would be at lower numbers. Most of the experts, and my absolute hero, Dr. Tony Fauci from the National Institute for Allergy and Infectious Disease, he's the older gentleman that you see on the news conferences all the time. He says he thinks it's probably going to cycle through for about 18 months. So we're going to have to take some precautions, extra precautions with like respiratory protection, reception rooms for a while. So it won't be going back to business as usual when we're told we can start seeing patients again. It will be different.
Wow. Okay, so I guess one of the things I'm curious about, for many reasons, and nobody has a perfect picture. Nobody knows what's going to be true, what's going to be the case. But what do you think? Are we shut down 2 weeks and it's going to be more? Are we shut down for a month? It's going to be more. If you don't mind, just what's your gut feeling? What this thing is going to look like?
My gut feeling is that it may be more than 3 weeks, but I think in the next week to 2 weeks, we will get a better picture of whether having, people working from home and staying home and not going out in public as much, I think we'll start to see things sort of not taper off, but again, that curve flattening. We won't see such a spike in new cases. I just watched a news conference this afternoon from my old home state of Michigan, and in 48 hours, the number of new cases increased by 400%. So we've got to stop those big spikes. So if we see that stopping, then it may not be that long. But there are some that are saying that this could even go as long as 2 to 3 months before we're able to get back to normally seeing patients.
Wow.
Yeah.
So I have this, maybe I don't know where it's coming from, but I have this weird thing in my head. Do you think that 2 to 3 weeks we go this, like we're not seeing any patients, but when it does come back, what's going to happen with all these patients? Do you think we're going to hit the opposite, where we're going to be working extra hours to see all these patients that we couldn't see for the last 2 to 3 weeks?
Well, that's very possible. I don't, we just don't really know what the public response is going to be. I think one of the most important things that every dental practice can do right now is stay engaged with your patients. So post on social media the types of
Mm-hmm.
things you're doing in your practice. We're training, we're reorganizing, we're getting even better at infection control than we ever were, but reassure them that you were very safe before. Now we're looking at how can we be even better, and just let them know what's going on. We don't know when we can open yet, but we'll keep you informed. There's lots of things you can post on in social media, and if you're using something like Weave or Solution Reach or Lighthouse, you can easily communicate with those patients because you can do posting on social media and you can send out emails to the patients. But I think we need to stay in touch with them to so that they know we haven't forgotten them. I
Mm-hmm.
do think that there will be a small segment of patients that will be fearful to come back
Mm-hmm.
because there's been so much publicity about dental practices shutting down. And last Sunday in the New York Times, there was an article about what were the riskiest occupations during this pandemic, and dentistry was way up at the top because of the aerosols that we produce. So there will be some fear. I think it will be similar to what we experienced in the late 80s and early 90s with HIV.
Mm-hmm.
Yeah.
Wow. For those of you who joined this webinar, I see a lot of people. If you don't mind, can you just drop it in the comments if you are planning to stay in touch with patients, or maybe even say how you're planning to stay in touch with the patients? Are you doing Instagram Live or anything like that? Just jump in. I would love to have the feedback from all of you guys. So
Yeah.
anything that yes or no. And then that will give us an idea. Maybe we should go in that route and just brainstorm on that a little bit. So while
Yeah.
people are responding, Mary, you briefly touched on, so what do we do if we're completely closed, and how to use the downtime effectively? What are the other things that offices can do? Obviously, stay in touch with patients, but what else? What are the
Mhm.
things? Obviously, we're locked down. Hypothetically, some states already locked down, but what can we do? How can we use the time effectively?
Oh, well, first and foremost, I hear everybody say all the time, I never have time to do X, Y, or Z. So
Mm-hmm.
I think this is time to have a team meeting. Even if some people are staying home, you can do a virtual meeting with Skype, and everybody, kind of participates and talks about the projects that need to get done. And that's where we go, whether we need to work on our inventory, whether we need to organize treatment rooms, whether we need to do some extra cleaning, looking at documentation. This is a great time to catch up on any kind of training, HIPAA training, OSHA training, whatever projects that you always say you never have time to get to. This is the time. We've been given this gift of time to get them done. And then if you get those projects done and we have maybe another extended time that we're closed, then I would look at maybe some kind of community service project that wouldn't increase your risk of exposure. But there are food banks, there are lots of service agencies that probably could use some kind of outreach help. And if you do those kinds of things, then you should share that with your patients on social media to let them know that what you're doing is trying to be part of the solution and not part of the problem.
Mm-hmm. So, Mary, I'm reading the comments from our offices from people saying emailing weekly messages, staying in contact with page social media, making sure to have one idea I have in my mind and about staying involved. So I think Vanessa wrote that marketing managers are involved in this. I
Yes.
also think if you're doing live, like Instagram Live, you can connect multiple accounts so two people can jump in. I would
Mm-hmm.
probably, again, I love dental assistants, so I'd always want to do a plug. And I would say any marketing managers, they can include the dental assistants from the office into the live and say, all right, so for example, if I'm the marketing manager, I'm getting Vanessa to join the Instagram live, and I will
Mm-hmm.
say, so Vanessa, let's talk about how we're going to get ready, what you're going to do from a clinical standpoint to get ready for a patient. So I would probably include that, right?
Oh, absolutely. Because, and we don't want to forget, Julie had a question about what we should do to close the office
Yes.
down. So we want to review that. But absolutely, we do need to be ready because procedures will change. What we're going to need to do is communicate with our patients that um, we're going to be screening you over the phone, or we're going to be sending out those emails or text messages asking you questions about, do you have symptoms? Have you done any travel internationally? Have you been exposed to anyone with coronavirus? And we need to inform our patients that if you answer yes to those questions, we will reschedule an appointment for you to a later date. So we need to let them know that. We
Mm-hmm.
also need to let them know that if they would either have somebody driving them to the practice, or they might be bringing a family member with them, if that other person that comes with them has respiratory symptoms, even if the patient's okay, but the person with them is not, that you will ask that they wait in the car, or they wait out in like maybe a hallway or someplace not within your reception area, because you could be putting other patients at risk. So
Mm-hmm.
there's a bunch of those things that we're going to need to do.
You're so awesome. I didn't think about it when, and then actually, let's come back to that. I want to make sure we answer Julie's question,
Yep.
and then I'll bombard you with a couple more.
Okay. So Julie, that's a great question. Thank you.
Julie's a
One
rock
of
star.
the most important things to do before you close the office down, or if you didn't do it when you close the office down, you probably need to go back, and that is make sure that you have emptied out all the water bottles on your units. If you have a system that doesn't have a water bottle, that you turn the water off and then hit the rheostat and run the water out of your unit, because if that water sits there stagnant for a couple of weeks, you're going to get a nice little bloom of biofilm. Then when you go back, open the office back up, you're going to need to do a shock treatment.
Mm-hmm.
Make sure that your equipment is turned off. You want to try to save some energy, turn things off. Make sure that you've emptied out solutions, cold sterile solution if you use it, your ultrasonic bath, backed up any software. Trying to think of what else. I think
Empty
it's
the
just,
fridge.
yeah, empty the fridge, because you might get some interesting
Finally,
stuff when you come
get
back.
stuff out of there.
There could be things growing in there when you come back. Absolutely. But a lot of it's really, it's not so much, I guess, about, other than the water lines, it's not so much about shutting things down. It's really notifying the patients more than anything, so that they understand what's going on.
Mm-hmm. Awesome. I think couple ideas from this. I think we're going to do a live webinar next week for everybody on what tools to use, because we're really good at Zen of knowing what tools are easy, free, that you can use as a team to connect together. So I think we're going to do something like that. So if my team is watching, please somebody make a note that we'll need to do something like that for 30 minutes to show offices exactly how we connect and how to stay remote. And then let's see, Julie, best form of PPE, question from Instagram.
Well, this is something I hope that is going to make dental practices take PPE a lot more seriously, because up until now, until this very serious threat, we've still had other threats from, colds and flu and those types of things. And I watch people all the time either not wearing the appropriate level mask, and it should be a level 3 for aerosol producing procedures, but they wear their face masks under their nose. They're not wearing safety glasses, eye protection all the time. And a lot of people are not wearing some kind of protective clothing, like a scrub jacket or a lab coat over their scrubs. So you've got a cross-contamination problem that could put you at risk. So if I'm working in my scrubs, I'm seeing patients all morning, and then I go into the lunchroom in my contaminated scrubs, and I might touch my clothing, and then I touch my food. Not a good idea. So OSHA says you have to wear long sleeve jackets or lab coats while you're doing those procedures. A lot of people don't. And then when you go to the lunchroom, you need to take that clothing, the outermost clothing, the jacket off, leave it in the treatment room, and then go. You should not be wearing your contaminated clothing home, especially if you have little ones at home. So you need to be careful, careful, careful. I hope that people take PPE much more seriously when they do come back to work, but I think there's still some more education that has to be done. And I will tell you, I think what is probably going to happen, since there's been such a spotlight shined on dentistry because of the aerosols, is that we are going to start being scrutinized by OSHA again.
Yeah,
That
like
they have not
Tennessee
done.
before this thing happened.
Yeah. I think that we've not really been, we haven't been scrutinized like we were back in the beginning of HIV and AIDS, where they were doing random inspections and practices. But knowing that this is an airborne infection and that there are different types of respiratory protection that may need to be worn, I think we're going to be a target for OSHA. I could be wrong, but I think that's gonna happen. Hi, Lisa.
Lisa is
Lisa
my other
Lord. I have
favorite
not
person.
talked to you or seen you in a very long time. I get your question on orthodontic practices, and there was, even though you don't produce all the aerosol, like in general practices, you're not doing it all the time, it may be a good idea to do aerosol producing practices in a closed space, like an enclosed room, rather than out in the open bay situation. But again, I think life as we knew it in dentistry is forever changed because of this. And it's only a matter of time, according to Dr. Fauci and some of the other experts, that we will probably see another variant of this virus. That, we had SARS, and then now we had this particular coronavirus. There will be more. This isn't the last of it. Yeah.
Yeah. Vanessa also asked, we're currently stopped doing our brushing station as well. Do you recommend not doing this for longer?
I would probably not do it until we know that we're past this SARS or this COVID-19 outbreak. I would be very, very careful. And for practices that are working with the hygienists using ultrasonics, I think we're either going to have to provide an assistant or some way to be able to use high volume evacuation while those scalers are being used. I also think that we may see in restorative dentistry the trend going back to using dental dams, because that really controls the aerosol. I think there's going to be
that green thing that you put in the mouth and.
Yeah.
Okay.
Exactly. We used to call them rubber dams, but they're not made of latex rubber anymore because of latex allergies. But yeah, I think it's our world has been forever changed in terms of producing aerosols. Absolutely.
Wow. I'm sure there'll be a lot of funny memes on that on Instagram about using rubber dams again.
Well, and it could very well be that OSHA and the CDC say that we have to wear N95 respirators whenever we're doing aerosol producing procedures. That will make everybody in dentistry flip out, because they're so hard to breathe in. They're very warm. You have to do fit testing to make sure it forms or creates a good seal around your face. It's just it's going to be crazy. It's absolutely.
And And another good question. I mean, it's really not the right time to talk about it, but the cost of it, right? So
Oh,
all the masks went up from $3 a box to $7 a box. Now they're $40 a box, and there's so
yeah,
much going on. The good thing
there
is when
is.
it's like so the N95 is almost, what is it? We were looking at the numbers today. I think it's $50 a box or $47, and prices do go up and down
Right.
within a week short of span. So I don't know if they will ever go all the way down, depending on if we bring the manufacturing back in the United States and all these different things that will affect it. But
Yeah.
if we are required to use N95, which is what, at least 5 times more expensive,
Yes.
I think that's a lot. I mean, a lot of people will be raising that question too.
Well, absolutely. And when we're not really able to raise fees to accommodate that, but then maybe that's something that some of the benefits companies are going to have to look at, that they've never allowed us to have a separate fee for infection prevention and control procedures, but they may have to do that now because this is going to be a significant increase in our cost. But I just wanted to say a couple of things based on your comments. One is that there is this perception that most of the face masks are manufactured in China or outside the US. The largest manufacturer of face masks is actually, it's Crosstex, which is now
Mm-hmm.
part of the Hugh Freedy group, and they're in New York. They're in the
Mm-hmm.
US, and they're the world's largest manufacturer, and they do make N95 masks. And another very large manufacturer, Medicom, is in Canada. So
Mm-hmm. Really good
North
company.
America has a lot of good resources. But what several of the suppliers have told me is that they have increased their prices because they are having price increases passed on to them from the manufacturers.
Okay.
And so it's kind of a supply chain thing, but that the intent is to, once the supply is more plentiful, to lower the prices back. Now, whether that will happen or not, I don't know.
Mm-hmm.
It's, that remains to be seen. But the other thing is, and one of the reasons why we have a lot of shortages, is that some of these manufacturers are looking at, okay, where am I going to sell these at the best price? And it might be that the best place to sell some of the N95s right now has been in China or Italy. And if they're willing to pay more money for them, then that's where they're shipping them rather than keeping them here for our healthcare system here. So,
It's
it's crazy.
so
This is
interesting. Yeah.
completely unprecedented.
Yeah. I think a lot of people are questioning what affected such a price hike on the masks, and if it's the same mask, if it's the same
Yeah,
thing.
it's supply and demand.
Exactly.
It's just like the people out there on the internet selling hand sanitizer for $79 a bottle. It's crazy. It is crazy. One of the scariest things that I have heard and seen on like Facebook posts and chat rooms has been a recommendation from some people that they think it's okay to take their level 3 face mask and spray it with disinfectant so they can reuse it.
Mm-hmm.
And that is like the worst thing you can do, because once a face mask gets wet, then the filtration protection is gone, and it will actually act as a wick to bring in contaminants. So that's the worst thing. And then some people are saying, well, they put them in the sterilizer. Well, it gets damp in the sterilizer too. So you are compromising those masks. Many dentists have called and asked, is it okay if they just have their employees sign a waiver that they will work without a face mask? And that is not acceptable either. If you don't have face masks, you shouldn't see patients. Simple as
Yeah.
that. We can't put ourselves at risk. There's too much at stake here at this point.
Maybe, Mary, maybe we'll figure out how to use this. Is not maybe we'll figure out, but maybe in a week or two, I'll get you back and Julie, if you guys are still available, just to talk about some of the, part of my language, dumb shit that we see.
Yeah. Oh God, it's crazy.
Just I'm sure
Oh,
Julie have seen a lot. I can't wait to
yeah.
hear what she would say. But like, I don't even know, and maybe people will write more stuff on the chat. But just the stuff that we've seen is ridiculous. Not seeing patients without a mask. I mean, I'm
It is
sorry.
so risky, and I think people have gotten sort of complacent in the area of infection prevention over the years. You know, we sort of peaked in the days of HIV scares, and then we kind of got complacent. But I think we're going to swing back up again. We're going to have a whole new level of awareness, and we need to, because patients are going to scrutinize this more than ever. Back
Mhm.
when we had the HIV cases that were traced to the dentist in Florida, it caused a huge stir because these stories were on the news. But that was
Mhm.
before social media. If that happened in the age of Instagram and Facebook, our practices would have been shut down. Patients would have run for the hills.
Mhm.
And so it's going to take a lot for our practices to rebound and be able to reassure patients that it really is safe for them to be there. Somebody asked a question about the nitrous hoses, or the nose pieces. I would switch to using disposables. I wouldn't even use reusables. Not now. Probably not ever again. Crosstex makes a really great disposable one, and they're not horribly expensive.
Mhm. Wow.
And the other thing, somebody mentioned something about the schedule. We may be given some scheduling parameters that we may have to have a certain amount of time in a treatment room, um, it part of turnover time, so that there can be some air exchanges and literally clear the air before we can put another patient in. We just don't know. There's so many unknowns
Yeah,
right now.
that's one thing I wanted to say. That one of my biggest takeaways from this is I I agree with you. I have a feeling it's not going to be like 3 weeks from today, 4 weeks from today. We just come back to the regular, and
Oh
just
no.
like business as normal, things are going to have to change. And I think a lot of offices will need to stay up to date with CDC and everything
Yeah.
else, all the requirements on when you do come back. How do you stay compliant? Either it's going to be enforced or not. It's a different story. We can always talk
Yeah.
about what's going to be really enforced. Like, but just for
Right.
your own safetiness, coming back, it's going to be a completely different world, in my opinion, too. And I
Oh yeah.
totally agree with you. And I think that's going to be my biggest takeaway.
Yeah.
Which my point is, we're going to try to bring that value to our users before they open, that they can see this stuff. Uh,
Yeah, absolutely. I think this is a great time for teams to meet and really talk about that. I mean, I hear team members right now, and Julie can attest to this, that there are just some horrible, awful, uncomplimentary rants, if you will, on the part of team members about their doctors, and they ask me to do all these unsafe things, and I don't like this, and that's a conversation that needs to be had in the practice, that everybody has got to be comfortable on that team, that their doctor is going to back them up, that their doctor has their best interest and safety at heart. And if they don't, then I would encourage that team member to go find another practice to be in where they feel safe. But this is the time right now, when there aren't patients all the time, to sit down and have those serious conversations about what are we about, and putting people before profit.
yeah, that's going to be hard for a lot of offices. I think
Yeah.
another webinar we're going to do is financial implications of the virus. I just took to my note. Sometime next week, we're going to try to find somebody. If you guys have recommendations on who do we talk to, but literally, what are the options assistants will have while they're off or not working, and other team members, not just dental assistants. But
Sure.
I think that's going to be important. Before we go back to questions from our chat, there's a lot of good ones. One more. So we briefly talked about it, how to prepare to when we come back. So stay informed, right? Uh, get
Yeah.
like literally ready, stay healthy, stay in shape.
Yeah.
Anything else?
Well, actually, when you physically go back into the office, that's when those new screening procedures are going to start taking place, that asking when you're confirming and so forth. But then you're going to need to run a shock treatment, most likely on your water lines. You
Hmm.
should run a spore test on your sterilizers, but also run a chemical integrator at the same time, the strips that you put in every load. Because if you use a mail out service for your spore test, you're not going to get the results back right away. So run a spore test, send it out, or process it in the office, put an integrator strip in. So test all the sterilizers. This would be a good time to check your ultrasonic unit to make sure it's functioning properly with, let me make myself a note here, Tiger, and I'll send the test procedure. It's using aluminum foil.
Yep, Julie said
I can't write and talk at the time anymore. So yeah, I'll send you that so you can add that, push that through to everyone. This is a good time to make sure before you open back up to make sure you have all of the prevention and control supplies you need. Do we have disinfectant? Do we have masks? Do we have enough barriers? All those things, and make sure that you clean up your, this is a great time to get rid of clutter in the office, but especially clean up your sterilization area, because I have the feeling what's going to happen, very similar to back when we had the AIDS issue, is that patients want to see what your sterilization area looks like. They want to know what you're doing. And if that sterilization area isn't pristine and looking very aseptic, oh, you don't want to show it. It will do far more damage. And you should also, thank you, Julie, you should also test your water lines. So when you come back, we can stop, and then you test.
Yeah.
So that's something that you actually probably would want to do a day or two, probably 2 days before you open the practice again. Because if you do an in-office water test, that's going to take at least 2 days, possibly 3, depending on what you're using, to make sure that you're below that 500 CFUs before you start seeing patients again.
Mary, let's take a few more things there. Lisa asked, are there modifications to the HVAC system to create rooms with more rapid air turnover, improve air quality?
There may be, depending on the facility that you're in, or there are air cleaners that you may be able to put in the treatment rooms that have HEPA filters, and they, of course, then help with the air exchanges. So again, we may start getting some recommendations from the CDC and from OSHA about that. We just don't know, but there may be some.
Yeah. Waterline testing. Vanessa wrote, we currently use Cerasil straws, and we were told to just make sure the water bottle is filled. You recommend we always dump out and fill again?
Yes, because a dry system, that dry water bottle, is then not a place where you're going to have more biofilm reforming. So yeah.
Okay.
Empty the water bottles.
A comment from my team member. I've worked for a dentist who did RCT without rubber dams.
Well, yeah, that's a liability, because, and the reason that endodontists used rubber dams more than anyone else is because people would aspirate the clamps, the rubber dam clamps, or not the rubber dam clamps, but the files, the endofiles. And so that's why it was a really good thing to use, because it kept the files from going down their throats. So yeah, that's scary. That was, in between my first and second year in hygiene school, I worked for an endodontic practice in Michigan. And because I was a registered dental assistant who could apply rubber dam, I was the rubber dam queen on Fridays when I worked. That's all I did all day long, was place and remove rubber dams.
Wow.
I could probably still do it in my sleep, even though I haven't done it for a very long time.
Wow. All right. So let's, guys, if you don't mind, throw more questions while we still have Mary. She's amazing. So Mary, where people can go to get trusted source of information, not something that on Facebook
or YouTube.
YouTube. We're going to be on YouTube for this thing, so this is
Yeah,
trust.
well, yeah, exactly. But you're a trusted source. Somebody was asking me about that today, that there's something about, somebody's got something about laundry, how all the microbes are still alive on the laundry, and you got to run your clothes in the dryer on high heat for 40 minutes. And, you know, it's got to come from the CDC, the World Health Organization, the American Dental Association, your state dental association,
Julie
or
said,
a
OSAP,
state
CDOS.
health department. Yeah, it's got to come from one of those agencies, CDC especially. It's,
Mhm.
from the lips of Anthony Fauci.
So, from your experience, Mary, who is the most proactive out of all of them? Because you know how some government agencies, they're just sitting on their rear ends until something is pushing them and all that. But is there an
Oh,
organization that actually is proactively trying to get stuff done?
well, that would be the CDC. They're not one of those do nothing agencies. But Julie, I'm so glad that you're on here, even though you can't talk to us, because in my brain dead state, I totally forgot about OSAP. There
Mhm.
is an infection control organization just for dentistry called OSAP. It stands for Organization for Safety, Asepsis, and Prevention. And you can join. I don't know, for about $100 as an individual member. Right now, they have opened up all their resources to non-members. So if you go to osap.org, you can access all the resources that they have. And there's lots. And they stay on top of all of these issues that we have in dentistry. So that those are great resources. Great resources.
And for my team that's watching, let's make sure to link it up in the resources in our page. And Julie, if you don't mind, can we use your code for the Zen members for the OSAP 50% code? So Julie just typed, awesome. You're amazing, Julie. So
Great. That's fabulous.
yeah,
So
so
they can
whoever
get
is,
50% off.
yep,
Yep.
agree with you,
That's
Vanessa.
great.
Yep.
And OSAP also does a lot of lobbying, if you will, on the part of dentistry. I've been a member for probably 30 years. And in the beginning, they were trying to convince groups like the American Dental Association how important infection control was. And they would just kind of pat people on the head and say, yeah. Well, now they are the organization that the ADA goes to. In fact, they're producing an on-demand webinar that's supposed to be available starting this afternoon, that it's a joint program between the ADA and OSAP all about the COVID disease. So, and Eve Cooney and Kathy Eklund, who are the presenters, are fabulous, very knowledgeable. So yeah, thanks, Julie, for jogging my memory there.
So Mary, as we're gonna try to start wrapping this up, looking back 15 years from now, 10 years from now, obviously is going to be a big thing. We're going to remember this.
Yeah.
What would be one positive takeaway from all this?
I think one positive takeaway is that this has the potential for us to become better at what we do in terms of providing a safe environment for our dental patients, just to really fine tune those infection control protocols. I also think it may help us to fine tune our communication skills with our patients, because that's going to be a critical piece here, that we really have to convince our patients that it is safe to come back into the dental practice. But we also need to, as Vanessa, you were saying, that we need to band together and not make this all about doom and gloom. I really think that this is, in some small way, a gift to us to get off the treadmill, the busy, turn those operatories over, get those patients in and out, take a step back and say, is that really the best way for us to be practicing? Because a lot of the practice management consultants will say that it's not about how full your schedule is that makes you the most productive and the most profitable. It's those relationships and the time that you spend with those patients that helps you actually produce more. So maybe we will practice at a less frantic pace than we have before, and it won't get us all stressed out so badly.
Yeah, I'm writing it down.
I think we're going to have a baby boom too, just saying. Just kind of like when there's a power outage. I think.
I was laughing with my friends a couple nights ago. I thought we probably gonna watch some really high statistics on divorces and baby boomers.
Yeah, it's going to go one way or the other. There are going to be babies born, or there are going to be a lot of couples that say, "Oh, I can't spend time with you anymore." I
Yeah, all
agree.
day with one person. Yeah, I better go back to my team. Okay, well, that's a good positive. All of you guys who watched, I think this was a really cool format where we get a chance to answer the questions live. Mary is amazing. I still feel bad that I couldn't get Julie in. She's amazing. We'll do another webinar next week with Julie, and we have a couple more people lined up for next week. So just tune in. Mary, any parting words to everybody who's watching?
Hang in there. It's, I think what we have a tendency to think very locally that, oh, it's just us and it's so bad in our practice, and oh, maybe I'm not getting my full paycheck or I have to file for unemployment. This has affected everybody. We're all in this together. I think we need to be grateful. Those of us who do not get sick, who are not sick, we need to remember that, have some gratitude about that, and just know that this will eventually pass. We'll get through it. And I think that we all will be much stronger as dental teams and perhaps as a dental community as well when we get through all of this. We will survive it.
Agree. There's a saying that we now say within Zen team, and every email that we send out, every training that we do, stronger together.
Absolutely.
Stronger
Absolutely.
together.
Yep.
Yep. So thank you so much. So for everybody who was working today, of course, shout out to the Forest Orthodontics. You guys are awesome. Vanessa, actually, shout out to
Shout
everybody
out to
who
everybody.
is awesome. Taking the time and learning and being on the live. This is amazing. Yep. Thank you to all of you. Mary, thank you so much for being a huge supporter of everything we do. It didn't
Absolutely.
even take a long time to convince you to join this. So this is awesome. So
No,
I really hope we're
you
going to do
know.
2 or 3 of those.
Okay, great.
Yeah. Awesome. Thank you all.
Okay, everybody have a
And
good weekend.
thank you.
Bye, Julie.
Okay. How do I stop this thing?